Welcome to Sunrise Radio. My name is Raj. Another episode of Health in Focus. A few weeks ago, we invited Dr. Dinesh Saralaya and Dr. Abid Aziz from Bradford Foundation Teaching Hospitals to come and join us and talk about the COVID-19 trials that were being undertaken at Bradford Royal Infirmary. We've invited them back this time to talk about the trials and what's the latest update. And we have two special guests with us today as well. We have Mariam and Yusuf, who unfortunately got diagnosed with COVID-19, but fortunately they're healthy and they're with us today, and they'll be talking about their experience. So I'm going to go over to Dr. Saralaya first. Dr. Saralaya, if you could just remind our listeners who may not have tuned in last time, your background.
So, thanks, Raj. My name is Dr. Dinesh Saralaya. I'm a consultant respiratory physician at Bradford Teaching Hospitals Foundation Trust. I'm also the director of clinical research and patient recruitment center at Bradford. And I've been leading all the COVID-19 clinical trials in Bradford as well as in the region.
And Dr. Aziz, if you could just give a brief background for our listeners too.
Hi, I'm a consultant in respiratory medicine at teaching hospital. I've been working in India for more than 10 years. I'm the specialty lead in Bradford, and I'm managing COVID-19.
Okay, we're going to go straight into the questions now. Describe your experience of managing COVID patients in Bradford so far, and has there been any recent change compared to when the pandemic started, and of course, when we last did this interview? So if I can go to Dr. Saralaya first.
Thank you, Raj, and I'm very grateful to our two special guests on this program, Mariam and Yusuf. They are our great ambassadors for the good work that is going on at Bradford Teaching Hospitals, because I know there's been a lot of information in the media, but these are two shining examples of the successes that we have had at Bradford Teaching Hospitals in treating our COVID patients. The last time I spoke, we were at the peak of the pandemic. This was in April, and we'd started seeing our first cases around March end 2020, and by the time we spoke last time, we were at the peak of our cases. Fortunately, the cases have decreased to some extent, but unfortunately, in Bradford, we are continuing to see a steady number of patients with COVID-19 admitted to our wards. And I think it is important that I pass this message, though the severity of the disease has come down to a certain extent. The numbers have not dropped significantly, and I'm sure Dr. Aziz will also echo it in his sentiments. So, for example, yesterday, we did a calculation of all the COVID-19 patients in the whole of Yorkshire and Humber. This is our entire county. And there are 153 patients admitted with COVID-19 across all trusts in Yorkshire and Humber. And out of that, 53 are admitted at Bradford Teaching Hospitals. That accounts for about 33% of all COVID-19 patients are admitted at Bradford Teaching Hospital. So the prevalence of the infection, though we are seeing in the mainstream media that the economy is opening, the shops are opening, we are returning back to some form of business as usual, it is really important that we are still cautious, as Bradford, I think, is still 2 to 3 weeks behind the South. So, for example, I was talking to a colleague who works in Southampton, and they are seeing very little cases now. But Bradford is not the case. We are still seeing new patients. Today itself, we have had 2 new admissions to our ward. And it's very important that people listen to the government messages. And our experience with treating COVID, we have 2 examples on this program. We've had tremendous success. So we've taken part in almost all the cutting edge COVID-19 trials in Bradford. And you must have heard in the news last week, Mariam, who's a guest in our program, was on the national BBC breakfast program, where she was interviewed about taking part in the big landmark trial called the recovery trial. And she took part in the arm, which was called the dexamethasone arm. And now dexamethasone, as of last Thursday, has become the standard of care. So every patient with COVID-19 gets dexamethasone. So as I've said before, this is not a single cure for COVID-19. We need to find at least 2 or 3 drugs. And our other guest, Yusuf, has also taken part in a landmark trial called the Accord trial, which is recruiting currently, to find the second and the third cure for COVID-19. Because ultimately, when we have a cure for COVID-19, it will be a combination of 2 or 3 medicines which will help cure our patients. And I'm very grateful to our 2 guests. as well as my colleague Dr. Aziz, in managing all these patients. And we had tremendous success. To date, over 500 patients have been successfully discharged from Bradford teaching hospitals. We have had one of the best outcomes in terms of treating these patients in the entire region. So we are not talking of just the city and the neighboring cities. It's the entire Yorkshire region. Some of the outcomes of COVID-19 are the best at Bradford Teaching Hospital. So it is important for the community. And the two guests of our program are also a shining example of what we've done so well at Bradford Teaching Hospitals.
Okay, thank you, Dr. Saralaya. I'm going to move over to Dr. Aziz, who will be able to reply in Urdu for our non-English speaking listeners.
शुरू हुआ था 1 लाख पेशेंट्स को रोजाना इन्फेक्शन हो रहा था और 1000 से ज्यादा डेथ्स रोजाना हो रही थी। ब्रैडफोर्ड रॉयल इन्फर्मरी में भी कोविड का जब पीक था तकरीबन 100 पेशेंट्स वार्ड्स पे थे एक टाइम पे। अभी ये पिछले कुछ हफ्तों में नेशनली इन्फेक्शन रेट में और डेथ रेट में कमी हुई है और हमने ब्रैडफोर्ड में भी देखा इन्फेक्शन रेट कम हुआ है, लेकिन अभी ब्रैडफोर्ड में हमने निस्बतन उतनी कमी नहीं देखी थी जितनी होनी चाहिए थी। जिस तरह डॉक्टर सारालाया ने कहा है अभी के होल ऑफ वेस्ट यॉर्कशायर में 150 पेशेंट्स हैं और उसमें से 50 पेशेंट्स इस वक्त ब्रैडफोर्ड टीचिंग हॉस्पिटल्स में हैं। जब पैंडेमिक शुरू हुआ था ये हमारे लिए नई बीमारी थी, हमारा एक्सपीरियंस नहीं था इसको ट्रीट करने का, लेकिन पिछले 3-4 महीने से हम मुसलसल इस बीमारी को ट्रीट कर रहे हैं, जिसकी वजह से हम इस बीमारी को ज्यादा बेहतर समझते हैं। पेशेंट्स को हम सपोर्टिव ट्रीटमेंट पहले दे रहे थे, अब भी दे रहे हैं, जिसमें ऑक्सीजन था, नॉन इनवेसिव वेंटिलेशन था। जिन लोगों में सीवियर रेस्पिरेटरी फेलियर था वो हम इंटेंसिव केयर में भेजते थे। पीक पे तकरीबन 18-20 पेशेंट होते थे इंटेंसिव केयर में, लेकिन वो नंबर अब 10 से कम हो गया। ये एक पॉजिटिव बात है। तो हमने पेशेंट्स को इनकरेज किया था कि क्लिनिकल ट्रायल्स में आप हिस्सा लें। तो जो रिकवरी ट्रायल, जो मेन ट्रायल है यूके में, जिसको डॉक्टर सारालाया लीड कर रहे हैं, इसमें हमने पेशेंट्स को इनकरेज किया था और इस ट्रायल ने साबित किया है कि जिन पेशेंट्स ने डेक्सामेथासोन आर्म, जो स्टेरॉइड ट्रीटमेंट आर्म में हिस्सा लिया था, उनमें मच बेटर आउटकम्स थे और ये थोड़े दिन पहले इसके रिजल्ट्स पब्लिश हुए हैं। सो दूसरा हमने ये देखा था कि जो कोविड के पेशेंट्स थे उनमें ब्लड क्लॉट्स लंग्स के अंदर उसका ज्यादा इंसिडेंस था, जिसको हम पल्मोनरी एम्बोलिज्म कहते हैं और हमारे ख्याल में उसकी वजह से भी डेथ्स हो रही थी। तो हमने ये सीखा है कि इन पेशेंट्स को ब्लड थिनिंग ट्रीटमेंट देना चाहिए और उससे भी हमारा ख्याल है कि डेथ्स में कमी हुई है। सो अगर आप पैंडेमिक के शुरू को देखें और अब देखें, बीमारी की इन्फेक्शन रेट जो है उसकी शिद्दत में कमी आई है, मगर याद रखना ज़रूरी है कि अभी ये बीमारी ख़त्म नहीं हुई और ब्रैडफोर्ड में उतनी कमी नहीं आई जितनी आनी चाहिए थी, जो हमारे लिए एक फिक्र की बात है।
Thank you, Dr. Aziz. I'm going to move over now quickly, very briefly, to Mariam. Mariam, if you could just explain your experience from literally day one when you got diagnosed, and in greater detail. Obviously you were a main part of the vaccine trials. So what was that experience like?
Hi. Can you hear me, guys?
Yes.
All right. Sorry. So I started getting with a fever and just a bit of sickness for about 1 week. And I didn't know what it was, but I did get told to isolate by my doctor, so I did. And a week later, I still wasn't better. The temperature hadn't got down, so we rang the 111, and the GP prescribed me with some antibiotics. So I took them, and 3 days later, I was still the same, and there was no change. So, then I developed a cough in the last, after a week, for the last 3 days of when I was home, I developed a bit of a cough, and then I was having a bit of difficulty breathing. So, an ambulance came, and I didn't really think it was still corona at this time. I just thought I was just, had a really bad, fever or some sort of infection or virus. What happened then was the ambulance took me to the hospital, and I got x-rayed, and they ran a few tests, and they said it was corona. And because I was having difficulty breathing, I got put on the oxygen. Well, first they gave me a bit of oxygen, and then they put me on the CPAP, the ventilator. And I got told I was going to be taken to the ICU, which was really scary because I've had my uncle, he was really poorly a couple of years ago, and he was in the ICU, and they said I was really scared. And then as soon as they were going to take me to the ICU, they changed their mind, and they said they were going to take me to a ward, which was like a miracle for me, because it is scary knowing that you're in a critical condition and anything can happen. And I've never been poorly before, and I've never had any underlying health conditions, so it was all new and very daunting, and it was really scary, especially when you're on your own, and you do want your family to be there for you, but we're in such a situation where it's best for obviously my family to be home. I can say Dr. Saralaya came to see me the next day, and he persuaded me to join the drug trial, and I said yeah, because I just wanted to help, to find any sort of treatment for anyone who's got COVID, and if it was going to help me as well. So he spoke to my dad and me, and I signed the papers, and I'm really grateful to Dr. Saralaya for prescribing me with that medication, because it brought me home, because I got told at first I wasn't going to be home for a while, but a week later, just as Dr. Saralaya promised, I was home. So thank you, Dr. Saralaya. I'm very, very grateful.
Now, there seems to be kind of like, Dr. Saralaya and Dr. Aziz touched upon it, that the figures are still quite relatively high, especially in the Bradford community. Do you think our community are taking this seriously? And what would be your kind of advice to our listeners about COVID? And that's to Mariam. Yes, Mariam. Oh no, looks like we've lost Mariam, unfortunately. Dr. Saralaya, I'll ask you the same question. Do you think, you mentioned it in your previous answer, that despite the figures being so high, it shouldn't be that high, especially in the community we have here. What would be your advice to our listeners? Are they taking this seriously enough, or are they treating it as a joke?
I have to pay, first of all the credit to the community in Bradford. In the initial parts of the pandemic, there was clearly a very strict adherence in social distancing and all the advice the government were giving us. Now, we definitely saw that the cases were not rising in Bradford as much as some of our neighbors and the northwest region in Manchester was experiencing. And that's a credit to the population of Bradford, because they were very careful. But unfortunately, the demographic of a city like Bradford is that we have crowded housing. We have lots of members of the families, 3 or 4 generations living in the same house. And what we saw was, even though the number of cases in the country, and people who are seeing the Downing Street briefings were seeing that the numbers were clearly coming down. But Bradford seems to have not changed that. We have not shown, there are many hospitals in our region which do not have a single case of COVID-19. Yet we are in Bradford today, we have 54 patients in our wards with COVID-19. So clearly there is something which the population need to be aware. So even though the national message is about easing the lockdown, allowing people to meet, opening up restaurants, opening up eateries, it is so important that our community realize that we are not out of this as yet. And it's important that they follow the government advice, sticking to the social distancing rules, washing their hands, making sure that they avoid vulnerable members of their family. And what is happening, I think, Bradford, there is a younger generation who have normally very fit. And Mariam is an example. She's a fit 18-year-old who got COVID-19. And what we have seen is all ages, there is no age difference, because at the start of the pandemic, we were told it was elderly people, people with lot of medical conditions, our grandmothers and grandfathers were vulnerable. But the two examples that we have on this program, the 2 patients, they are examples on how it can affect the young and previously healthy individuals as well. So it is an important message that I wish to pass to the community. We are not out of this as yet. I think we are probably 3 to 4 weeks behind London as yet. And it's important that we behave still, isolating ourselves and taking all the precautions that the government and the advisors are advising us, so that we actually beat this virus and then we get ready. So what we are doing is we are allowing the medical community and the research community to find a cure for this dreadful virus. And we need some time, but we need the cases to come down really dramatically, so that we can also, it's very important, all other activity, people with cancers and other diseases are not coming to the hospital. We need to open up the hospital for other non-COVID illnesses, because otherwise we are going to be hit with a tsunami when this is all over. You must remember, a lot of people are not coming to our hospital because they're scared that we'll get COVID-19. So the sooner that we get to come out of this infection and this lockdown, the better we will be as a city, and as a community.
Okay, Dr. Aziz, if you could give your answer in Urdu.
और मल्टीकल्चरल सिटी है जिसमें एक बेम पॉपुलेशन या एशियन लोगों की बहुत बड़ी तादाद है और उसमें ज़्यादातर लोग पाकिस्तानी हैं। तो पैंडेमिक के शुरू में हमने देखा था कि निस्बतन जो पेशेंट्स थे वो ज़्यादा कंपेयर टू द वाइट पॉपुलेशन ज़्यादा एशियन पेशेंट्स थे 45-50%, और उसमें ज़्यादातर मेल्स थे और अबव द एज ऑफ 50, लेकिन बिलो द एज ऑफ 50 बहुत पेशेंट थे। तो पिछले कुछ हफ्तों में हमने ये देखा है कि हमारे जो पेशेंट्स हैं अभी भी एशियन पेशेंट्स निस्बतन ज़्यादा हैं, लेकिन हमने देखा है कि यंग एशियन फीमेल्स बहुत ज़्यादा आई हैं इन द 30s and 40s। बल्कि रिसेंटली एक वीक में हमारा जो मेन कोविड वार्ड है वार्ड 31, उस पर मोस्टली पेशेंट्स फीमेल्स थी। तो ये एक काफ़ी फिक्र वाली बात है। दूसरा हमने ये भी देखा है कि मैं रिसेंटली एक वीकेंड पे ऑन कॉल था, तो 2 यंग एशियन फीमेल्स एडमिट हुई, तो मेरा उनसे वास्ता पड़ा है और दोनों पेशेंट्स को इतना सीवियर रेस्पिरेटरी फेलियर था कि दोनों इंटेंसिव केयर में चली गई और उनको हमें इनवेसिवली वेंटिलेट करना पड़ा था। तो हमें याद रखना ज़रूरी है कि अभी भी पेशेंट्स आ रहे हैं, इन्फेक्शन रेट कम है नेशनली, लेकिन ब्रैडफोर्ड में उतना कम नहीं हुआ और अभी भी पेशेंट्स सीवियर रेस्पिरेटरी फेलियर में आ रहे हैं जिनको इंटेंसिव केयर जाना पड़ रहा है और अभी भी डेथ्स हो रही हैं, तो इसको अंडर एस्टिमेट नहीं करना चाहिए।
Thank you very much. I'm going to move over now to Yusuf Amin, who will talk about his experience of being diagnosed with COVID-19. Yusuf, if you could tell us a bit about what happened, basically.
जी बेसिकली जैसे ਅਸੀਂ ਬੰਦੇ ਸਮਝਦੇ ਆ ਕਿ ਅਸੀਂ ਸੁਪਰਮੈਨ ਆ, ਕੁਝ ਨਹੀਂ ਸਾਨੂੰ ਹੋ ਸਕਦਾ, ਕਿ ਅਸੀਂ ਸਟਰੋਂਗ ਆ ਤੇ ਇਮਿਊਨ ਆ ਤੇ ਬਸ ਠੀਕ ਆ। ਤੇ ਮੇਰਾ ਵੀ ਇਹੋ ਹਿਸਾਬ ਸੀ ਪਹਿਲਾਂ ਕਿ ਬਸ ਹਸਪੀਟਲ ਦੇ ਬਾਰੇ ਚ ਕਾਫੀ ਅਫਵਾਹ ਸਨ ਕਿ ਕੋਰੋਨਾ ਜਾਏ ਤੇ ਹਸਪਤਾਲ ਨਾ ਜਾਓ, ਕਿ ਬੰਦਾ ਕੁਛ ਨਹੀਂ ਕੋਰੋਨਾ ਹੈ, ਵੈਸੇ ਹੈ, ਇਟਸ ਆਲ ਮੇਡ ਅਪ। लेकिन अबाउट 10 days ago जिले मेरी तबीयत शुरू हुई खराब होना, तो अचानक फिर जिले उन्होंने अटैक आया तो होश उड़ गए सही पुछा सवेरे। तो फिर पिछले मंडे रात बहुत मुश्किल गुजारी, तो लास्ट ट्यूसडे एंबूलेंस फोन करना पाया। तो ज़ाहिर है पहला तो डरिया सा कि कोरोना का ना हो, क्योंकि जिन्हें गल्लां कम्यूनिटी सुनिया सन कि अस्पताल जासो तो ट्रीटमेंट वैसे हो सी या कैसे हो सी, दोनों वापस आ सके नहीं। लेकिन जिले अस्पताल गया उत्थे डॉक्टर सरलाया नाल जिले इन्हां दे हे डायग्नोज किया, पहला तो परेशानी हो गई कि कोरोना हो गया, ओ ये हुण किस तरह बचना। लेकिन जी दवाई ना दी है, जी उत्थे मैं देखी है, जी खिदमत करते बंदियां दी, जेड़ा लुक आफ्टर करते हैं पेशेंट्स की, ते जिस तरीके नाल ट्रीटमेंट करते हैं इज आउटस्टैंडिंग। ते लेकिन असी लोग समझते हैं कि असी इम्यून है ते मुलाकात करते रहते हैं बंदियां नाल, लेकिन मैसेज आई थिंक ये होना चाहिए कि प्लीज केयर करो। जाहिर है बहुत ज्यादा लोग इम्यून हो सन, लेकिन फैमिलियां असी लेने वड्डी एक्सटेंडेड फैमिलियां, दादियां नानियां मामा नाल 5 6 7 8 लोग न साडियां फैमिलियां, ते स्प्रेड द रिस्क बहुत ज्यादा है। ते लेकिन जेड़ा स्पेशली यंग जनरेशन है, जिस मैं हूं, मैं अस्पताल तो वापस 2 घंटे पहले आया गड्डी च बैठ के, ते बंदे इस तरह ग्रुप विच घूम रहे हैं, खा पी रहे हैं, इतना क्लोज है, आई मीन 2 मीटर के वो ते हाफ मीटर की दूरी विच भी नहीं है। आई थिंक साडा एज एशियन कम्यूनिटी ज्यादा लायबल है असी नु कोरोना होना, ते सानू ज्यादा एहतियात सगों करनी चाहिए है। ते ज़ाहिर है अस्पताल की सर्विस बेहतरीन है, लेकिन जिस तरह डॉक्टर सलाया जिस तरह बाकी डॉक्टर आते अगर कोरोना के सारे पेशेंट हो गए तो बाकी ट्रीटमेंट्स बंदे ने कौन देखती फिर। लेकिन एहतियात करो ते प्लीज़ अपनी फैमिली लुक आफ्टर करो, अपने बड़ियां लुक आफ्टर करो ते एहतियात ज़रूरी है। ते मैं ते जेह्ड़ी हालत होई सी ते मैं सोचा सी कि बहुत टाइम लग सी रिकवरी च, लेकिन थैंक यू टू डॉक्टर सरलाया एंड द डॉक्टर्स जेह्ड़ी ट्रीटमेंट दित्ती है इट्स आउटस्टैंडिंग। ते आई थिंक वी आर लकी कि ब्रैडफोर्ड विच साढ़े कोल डॉक्टर सरलाया कन काबल फिजिशियंस न जेह्ड़ा होपफुली कोई हल निकाल सकते हैं इसदा। लेकिन प्लीज़ मैं ये कम्युनिटी नूं कैसा कि वायरस साढ़े बीच है ते लॉन्ग टाइम रहसी, दूसरे मुल्कां च भी देख लो फिर दोबारा आ सकते हैं। प्लीज़ एहतियात करो, बेशक तुसां नूं खुद नहीं है लेकिन थोड़ा बहुत एहतियात कर लो, गाइडेंस फॉलो करो। ते मैं चाहता कि जिहड़ी मेरी हालत होई सी या जिस तरह मरियम सरान दी हालत किसी और दी ना होवे ते लुक आफ्टर करो एक दूसरे दी ते खास कर ਅਸੀਂ ਆਪਣੀ ਕਮਿਊਨਿਟੀ ਦੀ ਆਪਣੀ ਲੁੱਕ ਆਫਟਰ ਕਰਨੀ ਹੈ ਤੇ ਇਨ ਡਾਕਟਰ ਦਾ ਸਾਥ ਦਿਓ ਤੇ ਥੈਂਕ ਯੂ ਟੂ NHS and thank you to BRI.
Thank you very much for sharing your experience with us. We're going to jump ahead. We're a bit short of time, so I'm going to move over now to Dr. Saralaya, who's going to tell us about the COVID clinical trials and possible future treatments.
So thank you, Raj. So as I've said, Mariam is an example that she got the first treatment which will make people better with COVID-19. And Yusuf also took part in a clinical trial which gave him an injection. Now, ultimately, when there's a cure for COVID-19, it's not going to be a single drug. Dexamethasone, which was mentioned and which Mariam got, is going to be the first drug, upon which we need to add 2 or 3 medicines to cure this completely. So we are in the process on a very, very fast pace to find a cure for COVID-19, because we need to get out of this dreadful lockdown, because we're not certain whether we're going to have a second wave, we're going to have more infections. And imagine when we get the flu season in September, October, and we have an old, vulnerable population. Both our patients here have got relatives who are old and vulnerable. One of them have also lost one of their grandparents. So we need to protect that community. And so it is really important for us as clinicians and scientists to find a cure. But in the meantime, when we get a cure, we need to keep the infection rate down. And so we are doing research at a very, very fast pace. So there are only 2 strategies for coronavirus. One is a cure and 2 is prevention. And I want to use this platform that Bradford will be the center of many of the vaccine trials for COVID-19. We have already been asked to prepare ourselves. And I want to appeal to the population of Bradford. Please take part in these trials because we need to find a cure. And as a Bradford, which is now a leading city in research, our population, as Yusuf mentioned, the BAME population has come to a lot of harm from this disease. We are still finding out why. There could be many factors for that. But our community, the local population of Bradford, needs to help us in this national and international drive to find a vaccine. So we are preparing, and soon there will be advertisements in radio, in TV, and in the local press that we will be doing these vaccine trials to find a vaccine which will ultimately cure COVID, prevent COVID-19. But in the meantime, we are doing research at a very fast pace to find a cure.
Dr. Aziz?
जी जब कोविड की हुई थी हमें कोई इसकी इफेक्टिव ट्रीटमेंट का नहीं पता था, तो वो क्लिनिकल ट्रायल्स जो यूके में शुरू हुए थे और सबसे अहम ट्रायल जो रिकवरी ट्रायल है जिसमें हमने पेशेंट्स को रिक्रूट किया नेशनली 176 हॉस्पिटल्स में पेशेंट्स को रिक्रूट किया 12,000 पेशेंट्स अभी तक तकरीबन रिक्रूट हो चुके हैं। तो उस ट्रायल की वजह से हमें ये फायदा हुआ कि पता चला कि जो स्टेरॉइड का ट्रीटमेंट आर्म था उससे एक डेथ रेट या मोर्टालिटी में एक सिग्निफिकेंट रिडक्शन हुआ है, जो एक बहुत बड़ी अचीवमेंट है क्योंकि इसके अलावा कोई इफेक्टिव ट्रीटमेंट नहीं थी। अभी भी ये ट्रायल ऑनगोइंग है फॉर द नेक्स्ट फ्यू मंथ्स, और इसमें दूसरी जो ट्रीटमेंट आर्म्स हैं जिसमें एजिथ्रोमाइसिन है, एंटीवायरल ड्रग एक है, एक इंजेक्टेबल थेरेपी है टोसिलिजुमाब, और रिसेंटली वो कन्वालेसेंट प्लाज्मा को उसमें शामिल किया है। तो उनके जब रिजल्ट्स एनालाइज होंगे हमें ये पता चलेगा कि स्टेरॉइड्स के अलावा भी कोई इफेक्टिव ट्रीटमेंट है या नहीं है, और अगर हमें कोई और इफेक्टिव ट्रीटमेंट मिलती है तो फर्दर हम इसकी जो मोर्टालिटी या डेथ रेट को हम कर सकते हैं। तो डॉक्टर सरालाया ने जिक्र किया कि वैक्सीनेशन के ट्रायल्स चल रहे हैं यूके में, ऑक्सफोर्ड ग्रुप और इंपीरियल ग्रुप ट्रायल्स कर रहे हैं, और आपको शायद बताना जरूरी है ये कि यूके में 5 सिटीज सिलेक्ट हुई हैं जो पेशेंट रिक्रूटमेंट सेंटर्स हैं, और ब्रैडफोर्ड भी उनमें से एक है, और जिसको डॉक्टर सरालाया के क्लिनिकल डायरेक्टर हैं। तो बहुत जल्द हम भी वैक्सीनेशन के ट्रायल्स में हिस्सा लेंगे जो फेज 3 क्लिनिकल ट्रायल्स हैं, और हमें उम्मीद करते हैं कि कोई वैक्सीन अगर कोई सक्सेसफुल उन ट्रायल्स की वजह से कोविड के खिलाफ बनती है तो उससे हंड्रेड्स ऑफ मिलियंस ऑफ लोगों को फायदा होगा। तो ये है कि पार्टिसिपेशन को हम इनकरेज करते हैं। अगर पेशेंट्स पार्टिसिपेट नहीं करेंगे तो हमें ट्रीटमेंट्स की इफेक्टिवनेस का पता नहीं चलेगा, और फ्यूचर में पेशेंट्स उससे मुस्तफीद नहीं हो सकेंगे।
Thank you, Dr. Aziz. Dr. Saralaya, you mentioned the word prevention in your last answer. What would be the prevention strategies? We've talked about the trial, the treatments, but actually I think it's more important for the prevention. So what would you say to that?
So I think the prevention strategy when the virus is still around in our city is to try and maintain social distancing, listen to the government measures. If you have any symptoms, don't go out meeting friends, stay at home, isolate yourself, seek medical advice. As Mariam very rightly said, if your symptoms are not getting better, seek help from your GP. That is 111, and they will be able to direct you to the right. So the prevention of coronavirus ultimately will lie in inventing a vaccine. So all of us will get vaccinated. So when the virus gets into our body, we would have formed antibodies in our body, and these antibodies will prevent us from coming to harm. But in the meantime, till we get a vaccine, which could be another 12 months away, so hopefully same time next year, we should have a vaccine and all of us will be out of this. But in the meantime, so till the winter and in the spring, we need to prevent patients from coming to harm. We need to find a cure. So when patients like Mariam and Yusuf come into hospital, they have been very, very forthright and very, very helpful in taking part in these clinical trials. And both of them left hospital in a week. So this is landmark, but this is very extraordinary. So there are a lot of patients who have spent 5 to 6 weeks in hospital with us. So they have been blessed, and they responded to the treatment that we are trying to invent for this disease. And by taking part in clinical trials, we will ultimately have a combination, as Dr. Aziz mentioned, 2 or 3 or 4 drugs, which we'll be able to give as soon as patients come to hospital, and they will not end up on CPAP, which Maria mentioned, or ventilation. They will get better, hopefully in 2 to 3 days, and go home. And then we can cure and save lives. The most important thing, we have to save lives. But in the meantime, till we get the vaccine, if we are able to save lives, we save as many people as possible. The vaccine comes, and the rest of the population who have been shielding and have been so curtailed. Imagine, we have lost our freedom. We are staying at home. We are maintaining social distancing. We are very worried to meet relatives. When do we go back to normal? When do we go back to normal is that when we find a prevention and a cure. So to prevent the infection, till we get a vaccine, you need to maintain the social distancing, washing hands, keeping away from people who may have symptoms, maintaining a lot of small groups, not to gather in large groups. I see when I go sometimes in Bradford on Saturday or Sunday nights, there are large groups of cars with young people sat in them, not maintaining any rules. So it's really important because these young people, even though they may not have symptoms, may be spreading it to their grandparents. Imagine, we've got grandparents, we've got fathers, we've got mothers who are very vulnerable. We've got a very high amount of disease in Bradford. So we need to be very mindful of who we are with at home. And I've been exploring along with Dr. Aziz, when we have patients admitted to the BI, we ask them, how many members are admitted or sick in the family? One, what we are finding is that a lot of people who live in multiple people in the household, but very often, very scaringly, it is the first person who's feeling unhealthy or feeling ill. So there is a chance that the other people get infected. So we got to really listen to the government advice, and I can assure the public that we will find a cure for this.
Thank you very much. Dr. Aziz?
Yeah. So infection को कि आप social distancing maintain करें, 2 मीटर का रूल है, अभी relax हो जाएगा. just about 1 meter 4th of July से अगर आप closed public places में हैं या transport में हैं तो face covering का इस्तेमाल करें. हैंड वॉशिंग जो है उसको अंडर एस्टिमेट नहीं किया जा सकता उसकी इम्पोर्टेंस को. अगर आपको सिम्टम्स हैं तो आप काइंडली आइसोलेट हो जाएं बजाय इसके कि आप दूसरे लोगों को स्प्रेड करें. अपना राब्ता करें NHS से, अपना टेस्ट करवाएं. और गवर्नमेंट ने अभी 28 मई को लॉन्च किया टेस्ट एंड ट्रेस प्रोग्राम जो एक इफेक्टिव प्रोग्राम है. तो जिस पेशेंट को वायरस होता है फिर गवर्नमेंट जो है डिपार्टमेंट ऑफ हेल्थ उसके कॉन्टैक्ट्स को राब्ता करती है कि आप भी आइसोलेट हो जाएं 2 वीक्स के लिए. तो इंतहाई ज़रूरी है कि हम सारे मेजर्स को अडॉप्ट करें ताकि बेहतर ये है कि हम इसको रोकें, इन्फेक्शन को, किसी को इन्फेक्शन ना हो. क्योंकि एक दफ़ा जब इन्फेक्शन हो जाता है अनफॉर्चुनेटली इसमें से कुछ पेशेंट्स को वेरी सीवियर इन्फेक्शन होगा और उनकी डेथ होगी. तो समझदारी इसी में है कि पहले आप प्रिवेंशन करें डिजीज़ की बजाय.
Thank you very much, Dr. Aziz. Last question, Dr. Saralaya, well, one of the last questions. What, in your opinion, will things look like in the next maybe 6 to 9 months?
So I think this is the norm. Maintaining social distancing, being very aware of where we are, how we are behaving, maintaining the rules ourselves. We don't expect other people, but we lead by example. So maintaining social distancing, listening to the government measures, and only using going outdoors, doing shopping only when it's absolutely essential is going to be the norm for some time. Of course, we have been all socially isolated, and this includes the doctors as well. All we have done in the last 3 months is only go to hospital, come back home. So compare this to what we were same time last year. So to get back to some form of normality, what I see the future is that we need to find a cure. So when people get COVID-19, like the 2 patients we have heard, they get better, and we see success stories like these patients. We want everyone to get better from COVID-19. And that will be the first success in this battle against coronavirus. But the second battle is, as we keep the infection rate down. Many of you all must have heard of the R rate. R rate is the rate of transmission. So when one person gets coronavirus, the rate at which he transmits, at the peak, when we started the lockdown, one person getting coronavirus was transmitting it to 4 people. Now it has been reduced to 0.7 to 0.9. We wanted to lower down to less than 0.2. And then what will happen is the infection rate will come down, the coronavirus will subside, and we will get back to some amount of normality. And the odd patients who get coronavirus, we will have treatment in hospital. You got to believe the healthcare system. People, nurses, doctors, all other healthcare professionals, frontline staff in the NHS are working overtime. Many have made great sacrifices, putting their lives on the line to treat patients. So we need to recognize that, and we need to respect that, because people, we are human beings. We are also getting tired. It's been 3 months of non-stop. So Mariam and Yusuf will know how the doctors and the nurses are there in their full PPE and the gowns in this hot climate. So we are working overtime to find a cure and get all our patients, brother, better. Please don't listen to what is being circulated in the social media. Everybody in Bradford, every single member in Bradford at Bradford Teaching Hospitals is working to get our patients better. We are trying our best. And what I see will happen is that we will find a cure and we'll get out of this.
Thank you very much. Mariam and Yusuf, I'll be coming to you shortly for a final message to our listeners. But firstly, Dr. Aziz, the same question. What, in your opinion, will things look like in maybe 6 to 9 months?
हाँ जी, ये कोरोना वायरस की वजह से हमें बहुत सारे चैलेंजेस का सामना करना पड़ा है, और ये लोगों हर इंसान की लाइफ को इसने चेंज कर दिया, और अभी ये बीमारी गई नहीं है, तो बहुत सारे चैलेंजेस आगे हमें फेस करने पड़ेंगे. तो इसमें एक खर्चा ये भी है कि सेकंड वेव आ सकता है. अभी ये 4 जुलाई से जो रिस्ट्रिक्शंस ईज होंगे, तो अगर उसकी वजह से ये इन्फेक्शन रेट ज्यादा होगा तो वो एंड ऑफ जुलाई अर्ली अगस्त में हमें पता चल जाएगा. दूसरा ये भी है कि कोरोना वायरसेस जो फैमिली है ये सर्दी के मौसम में ज्यादा एक्टिव होते हैं, तो हमें ये देखना पड़ेगा कि जो कोविड-19 का जो वायरस है ये सर्दी में के मौसम में कैसे बिहेव करता है. दूसरा, हमें ये वैक्सीनेशन का बड़ी एक शिद्दत से इंतजार है कि एक वैक्सीनेशन कोई तैयार हो जाए जिससे पेशेंट्स में इम्यूनिटी डेवलप हो सके और इन्फेक्शन रेट कम हो. लेकिन वो भी लगता है भी कम से कम 6 months to 12 months लगेंगे उसमें। तो दूसरा एक और भी है कि हमारे बहुत सारे पेशेंट्स को सिवियर लंग डिजीज हुई है, और इन पेशेंट्स में हमें खदशा है कि लंग फाइब्रोसिस या स्कारिंग होगा, जिसकी वजह से परमानेंट लंग डैमेज होगा पेशेंट्स में, और ये भी एक बड़ा एक बर्डन होगा एक पेशेंट्स के लिए और हेल्थ केयर सिस्टम के लिए। और इन पेशेंट्स में हमें खदशा है कि ब्रेथलेसनेस, फटीग, कॉफ के क्रॉनिक सिम्टम्स होंगे। तो हमने इन पेशेंट्स को भी एक लुक आफ्टर करना है कोविड क्लिनिक्स में, हम इनका फॉलो अप करेंगे। तो फाइनली मैं ये कहना चाहूँगा कि कोविड की वजह से लोगों की मेंटल हेल्थ पे बहुत इम्पैक्ट हुआ है, और वो हमें नज़र भी आ रहा है, और अगले 6, 9, 12 महीने में नज़र आएगा। और दूसरा इसका बहुत ज़्यादा इकोनॉमिक इम्पैक्ट हुआ लोगों को, और ये जो इकोनॉमिक इम्पैक्ट है इसका हमें पता अगले कुछ महीनों में और कुछ सालों में इसका हमें एक वाज़े तौर पे ये हमारे सामने आएगा सारे जो इसके इफेक्ट्स हैं।
Thank you very much, Dr. Aziz. Mariam, I'm going to come over to you. A final message to the listeners of Sunrise Radio about your experiences, and I think just highlighting the importance of kind of preventative measures.
Is important that we although lockdown is easing, we need to still, especially in Bradford, as Dr. Saralaya is telling us, that we need to still, maintain distancing and hygiene levels, because some people are not like I went to the supermarket the other day and we get provided with hand sanitizers and things, but people just walk past and don't use it. And it's really important, because if I stayed home and I put myself in lockdown before lockdown was officially announced, and if I can get corona and I almost touched death, so can anybody else. And it's really important that people understand that it can happen to anyone. And like Yusuf said, we're not Superman, we're not Superwoman, we can't think it's not going to happen to us. And a lot of young people especially do think they might understand that corona is something that's really terrible, but they don't understand that it can happen to them as well. And I just want to say, thank you to the NHS, because they are doing an outstanding job in taking care of myself and everyone. And I'm lucky because I'm only 18 and I have no underlying health conditions. And my granddad wasn't so lucky. In a week, he passed away, and he was admitted into the hospital the same time as I was, and not less than a week. And he passed away. So if it can happen to me and I maintained the rules and I followed everything, and it still happened and it caught me, it can happen to anyone. So that's just my message. Please take care and wait for the results to go lower in Bradford, and just take care of yourselves, because the NHS are putting their lives on risks, and we shouldn't make their life any harder. And if there's anything we can do to help ourselves, that's just maintaining social distancing and take preventative measures.
Thank you very much, Mariam, for joining us today and sharing your experience. Yusuf, if I can ask you to just make your final message to our listeners.
जी हाँ, मैं भी सोचा सी कि काफ़ी एहतियात मैं बरता था। मनु ये सी कि जिले बाहर जाओ, ध्यान रखो, सोशल डिस्टेंस रखो, जिले मास्क पहनो, लेकिन मनु हो गया तो ये किसी ने भी हो सकता है। एहतियात बरतो, अपने फैमिली की लुक आफ्टर करो, अपने नेबर लुक आफ्टर करो, अपने वड्डियां दी, अपने मामा दी, अपने बापा दी, नानी दादियां, साडी एक्सटेंडेड फैमिलियां, ते प्लीज ध्यान रखो, किसी ने भी हो सकता है। ते जे जिन्हों होंदा है बहुत मुश्किल घड़ी होंदी है, लेकिन अगर कोई है गल ते वन करो, जाओ अस्पताल, दी सर्विस सानू मिल सी BRI जिस तरह तो सानू बच्चा कन लुक आफ्टर करसन, तो सानू डॉक्टर सायला कन मिलसन फिजिशियन, they is fantastic, hard staff कदे भी रेडी होंदे 24 घंटे लुक आफ्टर तुसी करने वास्ते। ते मैनू इतनी जल्दी ठीक करके वीक के अंदर इन्होंने खड़ा कर दिता है, ते इन्हां दा बहुत शुक्रिया अदा करदा मैं। ते हुण साडा भी फर्ज बनदा है कि असी अपना थोड़ा बहुत ध्यान रखिए, सोशल डिस्टेंस नेशनली चलो कुछ रूल्स रिलैक्स हो रहे हैं, लेकिन सारी कम्युनिटी नूं ज़्यादा रिस्क है, सारी कम्युनिटी वास्ते ये ज़्यादा वड्डी गल है। फिर सानू चाहिए कि असी खुद ध्यान रखिए, असी अपना ध्यान रखिए, और कोई नहीं रख लगा। ਹੁਣ ਆਸਤਾ ਤਾਂ ਪਤਾ ਚੱਲ ਸੀ ਕਿ ਕਿਉਂ ਏਸ਼ੀਅਨ ਕਮਿਊਨਿਟੀ ਜ਼ਿਆਦਾ ਹੋ ਰਿਹਾ, ਲੇਕਿਨ ਅਸੀਂ ਪ੍ਰੀਵੈਂਸ਼ਨ ਕਰ ਸਕਦੇ ਹਾਂ। ਬਾਹਰ ਜਾਓ, ਮਾਸਕ ਪਹਿਨੋ, डिस्टेंस रखो, अगर किसी को है या आपको पता है किसी को है उससे ना मुलाकात करो, तो प्लीज 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 ध्यान रखो। ये बीमारी यकीन नहीं है, बीमारी जी थी है। ते सल्यूट टू द NHS and salute to BRI and to the doctors there, लेकिन प्लीज ध्यान रखो अपना।
Thank you very much, Yusuf. I'm going to ask Dr. Saralaya to give your final message to our listeners, please.
Raj, I have to thank Sunrise Radio for this platform so that we can bring these two precious patients to relate their experience to the public in Bradford. There have been a lot of messages circulating in social media which have been wrong. We have tried our best at Bradford Teaching Hospital. So right from the nurse, the porters, the healthcare, the cleaning, everybody in Bradford, it's not only a combined, it's a team effort. Everybody is working very hard to get patients better, as our two patients have virtually told they vouch for the services. So my only plea as I close, my closing remarks would be, please take care of yourselves. More importantly, take care of your families. Listen to the government advice. It is coming with a lot of scientific and lot of research. We are striving very hard to cure you. If by very bad luck you get coronavirus, please trust our hospital. It's one of the best in the country. It's delivering the best care. A lot of people, as I've told you, have got better. They've gone home. We've been able to change their lives. Don't hesitate to ask for medical help, because I've heard patients staying at home because they're scared to come to the hospital. Please seek medical attention at the right time, because if you get the right treatment at the right time, you will be like Mariam and Yusuf, home within a few days, back to your family. So please help us fight this dreadful disease. We are working hard to find a cure, and we'll bring a vaccine to Bradford. We'll ultimately play a very important role in that history-making exercise, what I call the vaccine trials. And if you do get a chance, please volunteer in these trials and encourage your friends and family to do so, because we will lead the way in finding a cure for this dreadful disease. Thank you.
Dr. Saralaya, just quickly, you mentioned about volunteering. How would people volunteer?
So what we want to do, Raj, when we are already going to be sending flyers, and what will eventually happen when the trials come to Bradford, it will be on the various social media. There will be advertisements on radio. You will find flyers in your general practice, in the supermarkets. We want to reach out to everybody in Bradford. Our ambition in our research institute is to reach every person in Bradford to take part in a clinical trial. So these two patients we've had the fortunate chance that they got admitted, but they took part in the trials, they got better. But same way, when we find a cure as well as a prevention for COVID-19, those trials, it's important. We will circulate it across the social media in Bradford as well as the various modes of communication. And if you do find, you can always ring the BRI through the switchboard and ask that you want to volunteer in vaccine trial. We will be able to direct you to the right person. And look out for the information when we are ready. It will be out in your station as well as in all the other media.
Thank you very much, Dr. Saralaya. Final remarks, Dr. Aziz.
मैं ये कहना चाहूँगा कि ये एक कोविड की बीमारी है, कोई शक नहीं है, एक इंतहाई डेंजरस और फैलने वाली कंटेजियस बीमारी है। यूके में 40,000 से ज़्यादा डेथ्स हुई हैं। एनी लॉस ऑफ लाइफ जो है वो एक बड़ा ट्रेजिक है, और वो एक ना सिर्फ उस पेशेंट को अफेक्ट करता है जिसकी डेथ हुई है, लेकिन उसके इर्द-गिर्द उसकी फैमिलीज हैं, उसके रिलेटिव्स हैं, उसके दोस्त हैं, सबको अफेक्ट करता है। तो लोगों ने एक बड़ा अच्छा रिस्पांस दिया नेशनली, और एक जो गवर्नमेंट की स्ट्रेटजी है, सॉरी, ये सोशल डिस्टेंसिंग एक्सेट्रा जो है, उससे हमने प्रूव किया है कि जो इन्फेक्शन रेट है वो रेट 3 से ऊपर था, अब 1 से नीचे आ चुका है। लेकिन दूसरा मैं ये भी कहना चाहूँगा कि ब्रैडफोर्ड की एक पॉपुलेशन है, ज़्यादा एशियन पॉपुलेशन इसमें काफ़ी ज़्यादा है, और वो ज़्यादा वल्नरेबल पॉपुलेशन है। तो ब्रैडफोर्ड की आवाम को ज़्यादा एहतियात करने की ज़रूरत है अभी भी, क्योंकि वो ज़्यादा वल्नरेबल पॉपुलेशन है। और दूसरा हमने ये देखा है कि ब्रैडफोर्ड में इन्फेक्शन रेट कम हुआ है, लेकिन उतना कम नहीं हुआ जितना रेस्ट ऑफ द कंट्री और वेस्ट यॉर्कशायर में हुआ है। तो हम रिक्वेस्ट करते हैं कि ब्रैडफोर्ड के लोगों से कि जो भी एक गवर्नमेंट की या डिपार्टमेंट ऑफ हेल्थ की एडवाइस है उसको फॉलो करें, और अगर किसी को इन्फेक्शन होता है और हॉस्पिटल में एडमिट होते हैं, तो हमारी ये भी रिक्वेस्ट है कि कोऑपरेट करें हमारे साथ। वो जो अभी क्लिनिकल ट्रायल्स चल रहे हैं उसमें हिस्सा लें, और अभी जो वेरी नियर फ्यूचर में वैक्सीनेशन کہ جو ٹرائلز بریڈفورڈ میں آنے والے ہیں اس میں بھی حصہ لیں تاکہ ہم اس کا کوئی پرماننٹ اس کا سلوشن ڈھونڈ سکیں اور اس بیماری کو کرب کر سکیں.
Thank you very much, Dr. Aziz, and thank you very much to all our guests who have joined us here today on the Health in Focus program on Sunrise Radio. Thank you very much. Goodbye.
Thank you.